Thank you. I'd like to start by acknowledging the traditional owners this land, the Gadigal people of the Aurora Nation, and I'd also like to pay my respects to the elders past, present and future. I work in Sydney Local Health District as a tobacco treatment specialist. I've been doing this work for about 10 years now. I'm also the project lead on a project called Focusing on the Carer, and I think Joanna Freeman, who I work with, is also here. Joanna, where are you? She's a project officer on this project as well. So I'm here today to talk about this project that we're working on, and it's still underway, and to present the preliminary findings. Okay, so the aims of this project are to enhance the capacity of carers to provide quit smoking support to mental health consumers. There are 4 stages to this project. The first stage, which I'll talk about today, is a carers survey, where we're looking at carers' knowledge and attitudes to providing quit smoking support, and also what are some of the barriers and what their education and resource development needs are. From that, we're developing resources which are printed and online resources that will be uploaded on websites by the end of this year, and we're working in partnership with One Door Mental Health, which was formerly the Schizophrenia Fellowship. The Schizophrenia Fellowship runs a Carer Assist program, where they run groups for carers, and as part of this project, we're going to develop an education program that will be run through the Carer Assist program. And finally, early next year, we'll run a Train the Trainer program for the facilitators of the carers groups, so that we can upskill them in providing quit smoking groups. The project's funded through the Cancer Institute of New South Wales, and it's due for completion in July 2018, and it has ethics approval. As I mentioned, we're partnering with One Door Mental Health, but along the way, thanks very much to Joanna, we've established other partnerships with Mental Health South East Sydney, Mental Health Carers New South Wales, Flourish and Headspace. So who are carers? Carers are someone who's actively caring for a person with mental illness. They may be a family member, a friend, or someone who has a significant role in the person's life. They may not be living with the person, but the caring role may vary over time according to the needs of the carer or the consumer. And by consumer, we're talking about somebody who's living with a mental illness. Why engage carers? Well, we've worked, in our roles, we've worked with mental health consumers for many years, and we've also had many carers coming into sessions, and we've identified that sometimes carers have misinformation about quit smoking, and that can get in the way of consumers quitting. But also research shows that carer involvement improves consumer participation in treatment. It also improves psychological treatment outcomes and medication adherence. So engaging carers in the quit smoking process can help consumers to use quit smoking medications more effectively, can also help them in terms of managing triggers, and can keep them going with a quit smoking attempt. Carers are also important in reducing relapse rates, because they are there at the time and can identify that the person's going to relapse, and early identification of that. State and national mental health policies also recommend carer involvement in treatment programs, and health services should provide carers with information and education about treatment interventions. So we've been doing that on a more ad hoc basis, but now we're trying to put systems in place to engage carers more in the treatment process, because most smoking for mental health consumers happens at home. And so if they're trying to quit smoking, a carer can play a really important role in helping them stay on track. In terms of the smoking rates across the general population in Australia, they're around 12.8%, but for people with a mental illness, they range from 35 to 73%. For drug and alcohol clients, I'm based in drug and alcohol, our rates are up to about 98%. The range depends on the severity of the mental illness. So the more the severe the mental illness, the higher the smoking rates. So for people with schizophrenia, they're in the highest group for smoking. So in terms of smoking and mental illness, compared to the general population, smokers with mental illness tend to smoke more heavily, and are more nicotine dependent, and unfortunately die approximately 25 years earlier than non-smokers, and this is because of their smoking. They're also less likely to be offered professional quit smoking support, and this is largely because health professionals sometimes assume that they're not ready or they're not interested, or it's too hard for them to quit smoking. I've heard so many times over the years health professionals saying that that's all they've got. That's all they've got. But actually, the research shows that mental health consumers are as ready as anyone else to quit smoking, but they might find it more challenging, mainly because of the mental health issues that they're experiencing. But there's also an impact of consumer smoking on carers, and I think that they're often forgotten in this. We know that people who are exposed to secondhand smoke have higher lung cancer risks, almost the same heart disease risks as smokers. And because the smoking rates are much higher with mental health consumers, that puts carers and other family members at increased risk. We also know that because mental health consumers will smoke more heavily, they experience stronger withdrawal symptoms, and that can be increased agitation and tension, and that can place increased stress on carers. There's also now the financial burden. I had a client yesterday who told me he's spending $35 on a packet of cigarettes. He's on the disability support pension, which is just over $400 a week, and he's spending more than half of his pension on smoking. So that also places increased financial pressure on carers. What we know about quitting with mental illness, it can be more challenging because of the heavy smoking and chronic stress, and because many mental health consumers have fewer social supports, and for some have cognitive impairments. But the main barrier that we see in the clinic are fears by consumers and carers about quitting that will make mental health worse. I've worked with thousands, I think, of consumers around quitting over the years, and I liken it a lot to going skydiving. And before somebody goes skydiving, there's often a lot of fear and trepidation about doing that. Oh, that's true with quitting smoking. I see a lot of fear, particularly we know that anxiety increases the day before somebody quits. But we also know that support helps, and carers are in a really great position to provide that support. The good news is people with mental illness can and do quit successfully. They may have their antipsychotic medication reduced when they quit, and we know that their mental health improves. In the old days, they used to tell people who had a mental illness not to stop smoking because they thought that it increased mental health issues, but we now know that it improves mental health. They have reduced stress, anxiety and depression, and improved mood and quality of life. So, the Carers Survey, we're looking at evaluating carers' knowledge and attitudes around quit smoking. We wanted to find out how many carers compared to consumers smoke, because we couldn't find any data on this. We also are looking at what support services they access and what their resource and education needs are. We've used an online and paper-based survey, and we've disseminated this through One Door Mental Health, Sydney LHG and the other services. This is an ongoing survey. It started in January and will run through till May, and I'll present today the findings so far. So far, actually this says 94, but Joanna, how many have we had now? Is it 98? So it's increased since I submitted this. Most of the carers who have responded are over the age of 50. Most of them are born in Australia and speak English at home. Most of them are living with others. When we looked at, when we've asked about smoking rates, and this is carers self-reported smoking rates and carers reporting on consumer smoking rates, what you can see from this slide is that the majority of consumers are smoking, so over 80%, compared to a much lower rate among carers, and there's more carers who are ex or never smokers. What carers reported about the main triggers for consumers to smoke, there's probably no surprises here. Stress, boredom and being around other smokers. Anxiety and substance use were also triggers as well. Most carers reported that consumers had a high level of nicotine dependence. 77% were smoking within 30 minutes of waking, and 58% reported smoking 20 or more cigarettes a day. Of the consumers who smoked, the carers reported that 44% were smoking inside the home. So strategies to reduce smoking inside the home, they've probably had some effect, but there's still high smoking rates inside the home which need to be addressed. 62% indicated they were not planning on giving up. Many of them had used quit smoking medications, and mainly it was nicotine replacement therapy. And many sought support through a GP. We asked carers about their views around quitting. Many carers thought that quitting was too hard for consumers. Many had misconceptions that smoking reduced stress for consumers. We know that it actually increases stress. That smoking improved mental health symptoms. We know that it actually makes mental health worse, that quitting may harm mental health recovery. So our approach through developing our resources is to address those misconceptions. Most carers were interested in providing some more support, but were concerned that quitting would increase stress on them. Many wanted to improve their knowledge and skills, and these were the key topics that they wanted covered in education and the development of the resource: how to use quitting medications, do's and don'ts of providing support. There were other things as well, but these were the main topics. I'll just flick through from there. So where are we at? Well, we've developed a brochure which is nearly finished, and it should be up on our Schizophrenia Wandell Mental Health website and Sydney AHD website by the end of the year. We're also working on a video that will go with that resource, and they'll be uploaded to the websites as well. These will also be available to other services if you're interested, and we're working on the development of the group education program, and we'll run the trainer program next year. So if you are a carer or you know your service provides support to carers, we are still gathering data and collecting survey. We'd like to invite you to complete the survey. Joanne and I are here this afternoon if you want to give us your contact details, or if you would like a copy of the resources once we complete the project. Thank you.